Active observation of work environment and animals. It's important to keep an eye on the patient and owner's body language to determine if the treatment is safer in the back or in the room with the owner. So if the animal has aggression with the owner, then you want to separate them, but if they have separation anxiety, they might be comfortable in the room as far as being taken away. If there's time to lean, there's time to clean, which is a common saying that shows that if you have time to sit around and lay back, then you have time to clean, pick up. This also improves your work ethic, and it lets everybody in your clinic know, or your workplace, that you can do more than the bare minimum. Maybe you should volunteer to do tasks that some people don't really enjoy, or it doesn't really get done, so you do it. That way nobody else has to do it, and it shows that you take initiative. There's normally always something that needs to be done in a vet clinic, and you can always try to take advantage of a checklist or checking off things that might need to be done. If it's not in the medical record, then it did not happen. So if it's not recorded or stated, then you can't actually know for a fact it happened unless it's written or it's in the history. Explain verbal, nonverbal, and written communication. All medical records need to be recorded on paper or electronically. You can't trust verbal history most of the time. Verbals normally when answering the phone to talk about a pet's health, medication dosage, and it should always be recorded in case in the future the owner's like, oh, I didn't say that, or I didn't agree. And then nonverbal is putting it in records electronically or using email or text to talk about a patient. Whenever you're dealing with verbal communication, it's where the message is verified using words, orally or written, or in writing. Veterinary staff use verbal communication in conversations, phone calls, interviews, emails. Not emails. Emails would be nonverbal. And then nonverbal would be emails, texts, or it can be body movements. So looks, posture. If you notice that the patient and client are not happy and having a negative impact, you might want to change what you're doing. You want to make sure that you're using the right use of words, and then go from verbal to nonverbal. And then written communication is sending emails, which is also nonverbal, and clients answering message requests or sending a message request for medication refills, sending letters, writing in charts,